Hi, my name is Dr. Zaid, Medical Director for the Advanced Hyperbaric and Recovery Center here in Coquitlam, British Columbia, Canada, experts in hyperbaric oxygenation therapy. Recently, we have conditions of brain injuries, more specifically Natasha Richardson and her ski accident. Now, these are conditions that from my experience, immediately warrant the use of hyperbaric oxygenation therapy. We can prevent so much long-term damage, get immediate response if we apply hyperbaric oxygenation therapy in the beginning, especially within the first few months of therapy. But if we get it straight away, the amount of recovery is so much quicker. We have less debility, long-term debility. See, hyperbaric oxygenation works by providing that extra oxygen that's needed for the brain after a brain injury. When the brain is injured, it jars, disconnections occur, and there's areas of what we call penumbra, or lowered oxygen tension, as we get to the central area of injury. So, obviously, what do? We provide extra oxygen. The only way to provide that extra oxygen that goes into the brain and central nervous system is in a hyperbaric oxygen chamber. It's called the hyperbaric difference. When you're in the oxygen chamber, just pressurizing, the oxygen dissolves above and beyond the red blood cells normally carrying our oxygen right into the plasma. The fluid in the body becomes very high in oxygen, and all fluids. Now, what's a key fluid in our body? It's called the cerebrospinal fluid, the fluid that bathes the brain and the central nervous system. So, in a hyperbaric oxygenation chamber, what happens is this fluid becomes saturated with oxygen. There is no oxygen deficiency state, as we see in brain injuries. And now, these areas of the brain get recovery. You see, after a ski injury or a brain injury, it takes time for the body to rebuild and get the circulation and the oxygen and build that tissue. This is immediate. This is the only known treatment to immediately affect and increase the oxygen in the brain and spinal cord. So, anyone with a traumatic brain injury, as experts in the field of hyperbaric oxygenation therapy, anyone who has had a traumatic brain injury from a ski to a car accident should be in a hyperbaric chamber as soon as possible.